business, we move to item number 10, which is a resolution submitted by Councilor Mba that the administration appear before this council to give a report on the building reopening plans.
Councilor Ba.
Thank you, Mr. President. Wow, I must say that I'm really enjoying this conversation because I'm a proponent of community-based solutions. So thank you for the recognition. Mr. President, on this item, I want to say that, we are 7 months into the pandemic, and it seems like there's no end in sight. I very much applaud our Lord Mayor for his continuous leadership in these unprecedented times. However, parents have reached out to me about when buildings are going to be open for their kids to resume learning. There's more and more evidence, both internationally and here in the United States, that schools are not drivers of the coronavirus pandemic, especially young children who most need in-person education. I was privileged to attend the school committee meeting on Monday night. You yourself, Mr. President, you were in attendance. And it was very clear to me that even the school committee members, under the leadership of Chair Norman and the Honorable Superintendent Skipper, want to see kids, especially those with special needs, resume in-person session. To me, this is an equity issue. I've heard from physicians and experts in our own community that our administration school reopening plan is very different from all of our neighbors, including Arlington, Cambridge, Boston, Medford. I would like an explanation from the administration about a few things. One, why our plan is different from that of every other district. Two, what are the marginal benefits in terms of safety? Three, how do we know these benefits justify the cost, both in dollars and in known harms to children? And lastly, how can we include the voices of community experts in this decision-making process? In fact, if I have to be blunt, Mr. President, I mean our female community experts. They are at the front lines of our evolving understanding of community and school-based spread. In fact, I want to say that, Mr. President, I'm a little bit upset that we haven't been updated about the city's plans for its school buildings, even though the administration is going to need us to authorize any expenditures that can be paid from the CARES Act funds. So I'll need more information to do my job. And with that, Mr. President, I would like to sponsor two community experts, both physicians, Dr. Elizabeth Pinsky and Dr. Lauren Henley, to speak briefly to this item.
Let's see, Dr. Elizabeth Pinsky, you're unmuted on my end, and you have the floor.
Thank you, and thank you, Councilman Mba, for inviting us tonight. My name is Elizabeth Pinsky. I am a child psychiatrist and pediatrician at Mass General. Dr. Hanley and I represent a group of Somerville residents, including doctors, nurses, public health specialists, engineers, scientists, educators, special education parents, and others who are invested in safe school reopening. I'm going to very briefly try to give the committee our perspective about events over the past several months. As we know, Somerville schools closed for every child on March 12th. This summer, Superintendent Skipper presented a phased reopening plan, which was thoughtful, data-driven, and drafted with the assistance of the district's Environmental Health and Safety Committee, which includes nurses, doctors, public health engineers, testing specialists, and educators. We were very hopeful for a swift and safe process. As the council is aware, however, control of school buildings rests not with the district, but with the administration. At a September 21st town hall, without input or knowledge of the school committee or the district's Environmental Health and Safety Committee, the mayor stated that to open schools, we needed not just data-based mitigations, as were recommended by the district committee, but first, extensive mandatory surveillance testing, which is expensive, questionably legal, and which I would love to discuss, but is beyond the scope of my comment tonight. And second, extensive system-level HVAC remediation at a cost of $5 to $7 million. The mayor unilaterally announced that the earliest possible opening for any building would be December 1st, which would be a full 8.5 months since any child was last in the classroom. To be clear, ventilation is absolutely important for COVID mitigation, but the proposed standards were extraordinarily out of line with those recommended by any public health organizations, including the WHO, the state of Massachusetts, the Harvard Healthy Buildings Program, and they far exceeded, as Councilman Mbaugh said, those being implemented by all the other districts in the state, including Arlington, Medford, Cambridge, and Boston. I actually believe that they exceed those being implemented by any district I can identify anywhere in the world. Despite promising in August to release the HVAC reports that support these mitigations, the administration still has not made them public. They continue to decline input from the district's committee's expert, and despite requests for transparency, they have identified no expert team of their own. Additionally, while the administration has obtained a waiver to make this a no-bid contract, no contract has been awarded, with December 1st now less than 6 weeks away. Meanwhile, as we have heard, evidence continues to mount that with precautions like masking and distancing and ventilation, schools are not the drivers of community COVID transmission. So in summary, unlike our neighbors, Somerville's school buildings are closed because the mayor feels that uniquely, we need both a mandatory testing policy and $5 to $7 million of HVAC remediation. I believe that there are urgent questions that the city council can ask, some of which were very well stated by Councilman Mbaugh. So why are our standards different from every other district? Who are the experts guiding this approach? What are the marginal benefits in terms of safety? And how do we know that these benefits outweigh the costs? And I mean both the financial costs and, much more important to me as a pediatrician and a child psychiatrist, in terms of the harms to Somerville's most vulnerable children. I am going to end there, but to discuss those harms, I'm going to turn it over to my colleague, Dr. Hanley.
Hi, good evening. Thank you for having us tonight. My name is Lauren Hanley, and I'm an obstetrician gynecologist at the Massachusetts General Hospital. I am speaking tonight to express how disappointed I am in the process and planning for Somerville's return to in-person schooling. In the presentations given by the administration to date, it has yet to be acknowledged that there are grave risks to not reopening the schools, especially for our most at-risk learners, including special education, English language learners, and K-2 students. Decisions to reopen schools must always be framed by balancing the risks of returning with the risks of not reopening and how they will affect our children and our society in both the short and long term. It is a science and data-driven imperative to get these learners back in school as soon as possible. To be clear, the harms that we are weighing here include the following: depression, anxiety, grief, isolation, suicide, substance abuse, unplanned pregnancy, sexually transmitted infections, food insecurity, abuse, neglect, eating disorders, and permanent physical and cognitive delays for students who are not getting proper services such as physical therapy, occupational therapy, and cognitive therapies. Additionally, the Somerville Public Schools is legally obligated to provide services for our SPED learners. These include speech therapy, particularly for our 3-year-olds in the city, and these have not been provided since March. Additionally, remote learning denies an equitable and high-quality education to some of our populations at higher risk of contracting the virus. Despite efforts to make remote learning more equitable, current research shows that online approaches can even magnify or exacerbate these inequities. For example, how is a young child supposed to learn and manage their online curriculum when their caregivers are not necessarily proficient in English? For lack of time, I will not focus on this tonight, but this is an extremely important issue to delve into further. In sum, the risks of not going to school are immediate, urgent, and many are irreversible. Science and data tells us that these lost services in the early years cannot be regained. Each day, more data emerges that schools are not the drivers of COVID transmission, that schools with masking, distancing, and proper potting do not drive transmission. We must adapt to this newer data. Our COVID-19 protocols at Massachusetts General Hospital changed almost daily in the first weeks to months of our pandemic. Changing and adapting to new science is hard and can be very frustrating. As soon as you make a plan, you need to adapt. Thus, we cannot and should not move forward with a plan that may no longer be the best plan for this city. I urge the council to collectively use the checks and balances of this local government to ask why this particular plan for $5 to $7 million in HVAC mitigations and for the mandatory surveillance testing is better than other more attainable plans which are currently working in other neighboring communities. I urge you to please probe and advocate to help protect our children and get them back into classrooms to prevent these devastating psychiatric and innumerable other harms which are occurring each day that we delay. Today is October 22nd. I consider these secondary or non-infectious effects of COVID a Somerville pediatric public health emergency. In addition to the infectious risks of COVID, which we all know, it would be an honor to work with anyone in this city to help achieve the common goal of safe return to school. And if I can be, or any of us can be of any assistance in this matter, please feel free to reach out. Thank you so much for inviting us to speak tonight.